The occipitofrontalis is composed of two parts. The frontalis lies over the frontal bone and attaches into the galea aponeurotica and aponeurosis here, and the occipitalis belly attaches into and overlies the occipital bone, attaching into the galea aponeurotica. The action of the occipitofrontalis is to elevate the eyebrow and wrinkle the skin of the forehead like this. To palpate the frontalis belly, we place our palpating fingers here and ask the client to elevate her eyebrows, and we can strum perpendicularly across the muscle. We can then continue palpating it toward the galea aponeurotica. To palpate the occipitalis belly, we place our palpating fingers over the muscle belly and ask the client again to elevate her eyebrows as forcefully as comfortably possible and feel for the contraction of the muscle, palpating into it. We can then palpate the entirety of the occipitalis belly as the client contracts it. The temporalis is a muscle of mastication that overlies the temporal fossa and then attaches inferiorly to the coronoid process and ramus of the mandible. This muscle elevates the mandible at the temporomandibular joints, the TMJs. We place our palpating fingers over the belly of the muscle, and as the client engages the muscle by clenching her teeth, by elevating the mandible at the TMJs, we can feel for the muscle's engagement. We can repeat this procedure for the entire belly of the temporalis. We continue palpating the temporalis as the client contracts the muscle inferiorly. When we get to the zygomatic arch of the temporal bone, located here, it is difficult to palpate this muscle's inferior attachment inferior to that point. The masseter is a muscle of mastication. It attaches from the zygomatic bone and the zygomatic arch of the temporal bone and goes down inferiorly to attach to the angle of the mandible here. To engage this muscle, we place our palpating fingers over the belly of the muscle and ask the client to close and clench her teeth. As she does this, the muscle contracts and we can palpate perpendicularly across it. We then continue to palpate the entirety of the muscle as the client alternately contracts and relaxes it. To palpate the lateral pterygoid, using a gloved hand, we run our palpating finger within the vestibule of the mouth between the teeth and the cheek, along the external surfaces of the upper teeth until we reach the back molars. We then press posteriorly and superiorly, feeling for a little pocket in the tissue that is between the gum above and the upper teeth and condyle of the mandible below. To engage the lateral pterygoid, we ask the client to protract the mandible at the temporomandibular joints, the TMJs, and we press in gently, palpating as much of the muscle as possible. To locate and palpate the medial pterygoid from inside the mouth, using a gloved hand, we run our palpating finger along the inner surface of the lower teeth until we reach the back molars. We then press posterolaterally until we reach the back of the mouth. To engage the medial pterygoid, like the lateral pterygoid, we ask the client to protract the mandible at the temporomandibular joints, and we press in gently, palpating as much of the muscle as possible.